Hello everyone. Now let's learn about the infective endocarditis. So microbial infection of heart valves leads to formation of vegetations, and the vegetation composed of thrombotic debris and organisms which destroy the cardiac tissues. So subtypes of infective endocarditis is acute infective endocarditis and subacute infective endocarditis. So in acute infective endocarditis, so there is no previous damage of the heart is present, and this is because of staph aureus infection, which is highly virulent. Now the subacute previous damage of a heart was present, like rheumatic heart disease or ventricular septal defect, and the subacute infective endocarditis is because of streptococcus viridans. So acute was because of staph aureus and subacute because of streptococcus viridans. Now prosthetic valve due to staph epidermidis, and the IV drug abusers due to staph aureus. Most common valve involved is tricuspid valve. HACEK group, which is Haemophilus, Actinobacillus, Cardiobacterium, Enchylia and Kinglia. Now negative on the HACEK group is negative on blood culture, and it is also called the culture negative endocarditis because of previous antibiotic therapy. So Hackett group or HACEK group is negative on blood culture, is also called culture negative endocarditis because of previous antibiotic therapy. Risk factors are the rheumatic heart disease, which is most common, and the ventricular septal defect, IV drug abuser, septicemia, immunosuppression. Now, the morphology of infective endocarditis is first ring abscess. Vegetations erode the myocardium to produce abscess cavity. So, ring abscesses, vegetation erode the myocardium to produce the abscess cavity. Second is shedding of emboli is common because of friable nature of vegetation. Third, the vegetation these contain the fibrin, inflammatory cells and the microorganisms on heart valve. So fibrin plus inflammatory cells and the microorganisms on the heart valves are the vegetations. Now, in this diagram we can see the rheumatic heart disease, and the vegetations are small and seen on the line of closure. We can see this is the line of closure. Vegetations are very small and seen on line of closure. Now in infective endocarditis, the vegetations are large, seen on valvular cups. So these are seen on the valvular cups. In the NBTE or non-bacterial thrombotic endocarditis, which is also called merentic endocarditis, so in this, the vegetations are small and seen on line of closure. So these are seen in the line of closure, and these are non-destructive vegetations. In the vegetations in the NBTE or non-bacterial thrombotic endocarditis, the vegetations are non-destructive. Now let's see the in the SLE or Libman sac endocarditis, small vegetation seen on the lower surface of valve. So where we can see the vegetation on the lower surface in the Libman sac endocarditis. Okay. Now the clinical features of infective endocarditis are high grade fever, which is most consistent sign. Murmurs are present, weight loss is there, rod spots, which are retinal hemorrhages, osler knots, which are painful fingertip nodules. The person is having the painful fingertip nodules, Janway lesions, painless palm or sole erythematous lesion. So let's revise once more the clinical features: high grade fever, murmurs, weight loss, rod spots, osler knots, and Janway lesions.